There is a food that has been sitting in your refrigerator your entire life that you have probably been told, at some point in the last 20 years, to eat less of. Maybe your doctor mentioned it. Maybe you read about it. Maybe you simply absorbed the general cultural message that has been circulating since the 1980s. That cheese is a high-fat, high-sodium food that belongs in the category of things you enjoy occasionally and feel slightly guilty about, rather than things you eat deliberately because they are genuinely good for you. I am here to tell you that this picture is incomplete. And for adults over 60 who are concerned about muscle loss, strength, and physical independence, the incomplete picture may actually be working against you. My name is Dr. Clarence Martin. I have spent over 20 years working with elderly patients navigating the health challenges that come with aging, and one of the most consistent patterns I have observed is this. The nutritional advice that made sense for a 40-year-old with cardiovascular risk factors is not always the right advice for a 70-year-old whose primary health threat is losing the muscle mass and strength that keep them independent and upright. These are different problems. They sometimes require different solutions. And cheese, specific types of cheese, consumed in appropriate amounts, is one of those solutions that deserves a more honest and complete conversation than it usually gets. Today, I am going to walk you through the science of why certain cheeses are genuinely valuable for muscle maintenance in older adults, which specific types carry the most evidence, how much and how to consume them, and which types to limit and why. No exaggeration in either direction. Just the research, explained clearly. Let me start with what cheese actually is, nutritionally, because most people think of it primarily as a fat source and do not fully appreciate what else it contains. Cheese is produced by concentrating milk, removing most of the water and concentrating the proteins, fats, vitamins, and minerals that were present in the original milk in a much smaller, more calorie-dense form. What this means practically is that a small serving of cheese delivers a concentrated dose of several nutrients that are specifically relevant to muscle health in older adults. The most important of these, for our purposes, is protein. Cheese protein is predominantly casein, the same slow-digesting protein I have discussed in previous videos in the context of Greek yogurt. Casein forms a gel in the stomach and releases amino acids gradually over several hours, producing a sustained elevation of blood amino acids that supports muscle protein synthesis over an extended period. This slow-release characteristic makes cheese particularly valuable as an evening food. Consumed before bed, casein protein provides amino acids through the overnight fasting period when muscle protein breakdown would otherwise go uncountered. Research from Maastricht University in the Netherlands, one of the leading institutions for research on protein metabolism in older adults, has shown that pre-sleep protein consumption, particularly casein protein, significantly increases overnight muscle protein synthesis rates and improves net muscle protein balance. This is a specific, practical finding. Eating a small amount of cheese before bed is not an indulgence. It is a nutritional strategy with scientific support for muscle maintenance. Beyond protein, cheese provides calcium, which most people know is relevant to bone health, but which also has direct relevance to muscle function. Calcium is the trigger for muscle contraction. Every time a muscle fiber contracts, calcium ions are involved in initiating that contraction. Adequate calcium status supports normal muscle function at the cellular level. Cheese also provides phosphorus, zinc, vitamin B12, and, in the case of full-fat cheeses, fat-soluble vitamins including vitamin K2, which has emerging evidence for its role in both bone and cardiovascular health, and vitamin A. The fat in cheese, which has historically been the primary reason for recommendations to limit it, is now understood to be more nuanced than the blanket saturated fat is harmful message of previous decades. The research on dairy fat specifically, as distinct from other sources of saturated fat, has consistently shown a more neutral to modestly beneficial cardiovascular risk profile than was assumed based on the earlier lipid hypothesis. A large meta-analysis published in the European Journal of Epidemiology found that cheese consumption was not associated with increased cardiovascular risk and was in some analyses associated with modestly reduced risk, possibly due to the specific fatty acid profile of dairy fat and its interaction with the calcium and protein matrix of cheese. This does not mean cheese should be eaten without consideration. It means the blanket avoidance recommendation that many older adults received is not well supported by the current evidence, and that the benefits of appropriate cheese consumption for muscle health deserve to be weighed honestly alongside any cardiovascular considerations specific to your situation. With that context established, let me walk you through the specific cheeses that carry the most evidence and practical value for older adults focused on muscle maintenance. Cheese number 1. Cottage cheese. Cottage cheese is the cheese that Dr. Clarence Martin recommends most consistently to older patients focused on muscle maintenance. And the reason is straightforward. It provides the highest protein content per calorie of any widely available cheese, in a form that is mild, versatile, and easily incorporated into a variety of meals. A half-cup serving of low-fat cottage cheese, approximately 113 grams, provides approximately 14 grams of protein for roughly 90 calories. That protein-to-calorie ratio is exceptional. For an older adult who needs to maximize protein intake without dramatically increasing overall calorie consumption, cottage cheese is one of the most efficient tools available. The protein in cottage cheese is predominantly casein, approximately 80%, with the remainder being whey. This slow-digesting protein profile makes it particularly valuable before bed, as the research on pre-sleep casein protein specifically supports. Studies from Maastricht University showed that consuming approximately 40 grams of casein protein before sleep, achievable with approximately 1 cup of cottage cheese, significantly increased overnight muscle protein synthesis rates in both younger and older adults. Practically, cottage cheese is one of the more versatile cheeses in terms of how it can be consumed. Plain, as a high-protein breakfast or evening snack. Mixed with berries and a small amount of honey. Blended smooth and used in place of sour cream or ricotta in cooking. Eaten savory with herbs and vegetables. The mild flavor accepts both sweet and savory additions, which makes it sustainable as a regular part of the diet in a way that more strongly flavored options sometimes are not. Choose low-fat or full-fat depending on your overall dietary context. The protein content is similar. Full-fat provides more calories and more fat-soluble vitamins. Low-fat is appropriate if you are managing overall calorie intake or have specific lipid concerns discussed with your doctor. Cheese number 2. Ricotta occupies a similar nutritional space to cottage cheese, but with a different texture and flavor profile that some people find more palatable, and it has specific characteristics that make it worth discussing separately. Ricotta is made from the whey that remains after other cheeses are produced. It is technically a whey cheese rather than a casein-dominant cheese, which means its protein profile is different from most other cheeses. The whey protein in ricotta is more rapidly digested than casein, producing a faster rise in blood amino acids and a quicker stimulation of muscle protein synthesis. This makes ricotta more valuable as a breakfast or post-exercise food than as a pre-sleep option. A half cup of whole milk ricotta provides approximately 14 grams of protein and is rich in calcium, phosphorus, and vitamin A. Part skim ricotta reduces the fat content while maintaining most of the protein. Ricotta is also one of the more digestively gentle cheeses, lower in lactose than many aged cheeses because the lactose is partially removed with the whey during production. For older adults who have some degree of lactose sensitivity, which becomes more common with age, ricotta is often better tolerated than fresh milk or soft, unaged cheeses. Practically, ricotta works well as a breakfast food. Mixed with eggs in a scramble, it adds protein and a creamy texture, or served alongside fruit with a drizzle of honey as a higher protein alternative to yogurt. It also works well in savory preparations that can be prepared ahead and eaten throughout the week. Cheese number 3, Parmesan, authentic Parmigiano Reggiano or domestic Parmesan, represents a completely different category of cheese from the first two, and its value for muscle maintenance comes from a unique combination of factors that make it one of the most nutrient-dense foods available per gram. Parmesan is an aged hard cheese. The aging process, a minimum of 12 months for authentic Parmigiano Reggiano, often considerably longer, concentrates the nutrients and transforms the protein structure in ways that are relevant to both nutrition and digestibility. Most of the lactose is consumed by bacteria during aging, making Parmesan one of the lowest lactose cheeses available and well tolerated by most people with lactose sensitivity. Per ounce, approximately 28 grams, Parmesan provides 10 grams of protein. That is a remarkable protein density for such a small amount of food. The amino acid profile is complete and includes meaningful leucine content, the amino acid that acts as the primary trigger for muscle protein synthesis. Parmesan also provides the highest calcium content per serving of any commonly consumed cheese, approximately 330 milligrams per ounce, which is approximately 1/3 of the daily calcium recommendation for older adults in a single ounce of food. The practical advantage of Parmesan for older adults is that it is used as a flavoring in small amounts, grated over vegetables, pasta, soups, salads, which means it adds meaningful protein and calcium to meals where it would not otherwise be present, without requiring a separate serving of a protein food. 2 tablespoons of grated Parmesan added to a bowl of vegetable soup adds approximately 3.5 grams of protein. Over the course of a day of cooking this way, the accumulated contribution is meaningful. This is one of the reasons that traditional Italian dietary patterns, which use Parmesan and similar aged cheeses as flavor enhancers across multiple meals, produce the protein distribution across the day that researchers now understand is important for maximizing muscle protein synthesis in older adults. Cheese number 4. Swiss cheese. Swiss cheese, Emmental and its domestic equivalents, is a cheese that deserves more attention in discussions of muscle health in older adults than it typically receives, primarily because of a specific compound it contains that has genuine evidence behind it. Swiss cheese is one of the richest dietary sources of vitamin K2 in the form of menaquinone 7, or MK7. Vitamin K2 has been studied primarily in the context of bone health, where it plays an essential role in the activation of proteins that incorporate calcium into bone matrix. But emerging research suggests K2 also has relevance to muscle health, potentially through its role in activating proteins involved in muscle cell function and through its anti-inflammatory effects. A study published in Osteoporosis International found that vitamin K2 supplementation in older women was associated with preserved muscle mass and physical function compared to placebo. The dietary source equivalent, aged fermented cheeses including Swiss, has not been studied as specifically, but the K2 content of Swiss cheese is among the highest of any food, making it a practical dietary source of a nutrient that most people do not consume in adequate amounts. Beyond K2, Swiss cheese provides approximately 8 grams of protein per ounce, is relatively lower in sodium than many other cheeses, and has a mild flavor that most people find broadly acceptable. Its lower sodium content specifically makes it the better choice for older adults who have been advised to monitor sodium intake for blood pressure or cardiovascular reasons. 2 to 3 slices of Swiss cheese daily provides meaningful protein, calcium, and K2 in a form that can be incorporated into sandwiches, salads, eggs, or eaten as a snack with fruit or whole grain crackers. Cheese number 5. Feta. Feta is a traditional Greek cheese made from sheep's milk, or a mixture of sheep's and goat's milk, and it brings a nutritional profile that is distinct from cow's milk cheeses in ways that are relevant to the inflammatory component of sarcopenia. Sheep's milk contains a higher proportion of short and medium-chain fatty acids compared to cow's milk, as well as a different fatty acid profile that includes conjugated linoleic acid, CLA, which has been studied for its potential role in body composition and muscle preservation. The research on CLA and muscle mass is not definitive, but the signal in multiple studies is consistent enough to be worth noting. Feta also provides a complete protein, approximately 4 grams per ounce, lower than harder cheeses but meaningful, as well as calcium, phosphorus, and B vitamins, including riboflavin, which plays a role in energy metabolism in muscle tissue. Perhaps most relevantly for older adults in the context of muscle health, feta is a traditional component of the Mediterranean dietary pattern, the eating pattern that, across multiple large epidemiological studies, is most consistently associated with preserved muscle mass, physical function, and reduced all-cause mortality in older adults. The mechanisms are multiple and interacting: the anti-inflammatory effects of the overall pattern, the protein distribution, the olive oil, the vegetables. But feta, as a component of this pattern, contributes protein and calcium in a flavorful, lower-calorie format. Feta is higher in sodium than some other cheeses, so portion awareness is appropriate for those managing sodium intake. A small amount, an ounce or so, crumbled over a salad with olive oil, vegetables, and a protein source like grilled fish creates a genuinely muscle-supportive meal in the Mediterranean tradition. Now let me address the other side of this conversation: the cheeses that Dr. Clarence Martin recommends limiting and why. Not because they are toxic or dangerous in modest amounts, but because for older adults focused on muscle health, they represent poor nutritional value relative to their caloric and sodium cost. Processed cheese products, American cheese slices, cheese spreads, processed cheese sauces, are manufactured products that contain real cheese as an ingredient but combine it with emulsifying salts, additional sodium, vegetable oils, and other additives that significantly alter the nutritional profile. The protein content per calorie is lower than natural cheeses. The sodium content is substantially higher. The processing removes or alters many of the beneficial compounds present in natural cheese. For an older adult managing blood pressure and trying to maximize protein quality, these products offer the palatability of cheese without most of its nutritional value. Full-fat cream cheese, consumed in significant quantities, presents a similar issue: very high in fat and calories, relatively low in protein per serving compared to other cheeses, and therefore a poor trade-off for someone trying to meet protein targets without excessive calorie consumption. Small amounts as a flavoring are not problematic. As a primary cheese source, it does not serve muscle maintenance goals well. Heavily salted cheeses consumed in large quantities, certain blue cheeses, aged salted varieties, can contribute meaningfully to sodium intake, which for older adults with hypertension or cardiovascular concerns deserves attention. This does not mean avoiding them entirely, but being aware of portion size and total daily sodium in the context of overall dietary sodium management. The principle Dr. Clarence Martin applies is simple: choose cheeses that give you meaningful protein per serving, natural nutrient profiles including calcium and fat-soluble vitamins, and reasonable sodium content for your situation. The 5 cheeses discussed earlier meet these criteria consistently. Make them your primary cheese sources and use others as occasional additions rather than staples. Let me address a question that many older adults have when they hear a recommendation to include more dairy, including cheese, in their diet. What about those of us who have been told our cholesterol is elevated or who have cardiovascular concerns? This is an important question, and it deserves an honest answer rather than a blanket reassurance. The relationship between dairy fat consumption and cardiovascular risk has been substantially revised in the research of the last 15 years. Multiple large-scale studies and meta-analyses have found that dairy consumption, including full-fat dairy, is not associated with increased cardiovascular risk in most populations, and is in some analyses associated with modestly reduced risk of stroke and cardiovascular events. The specific fatty acid profile of dairy fat, the calcium content, and the protein matrix appear to interact in ways that produce a more favorable metabolic effect than would be predicted from the saturated fat content alone. However, individual responses to dietary saturated fat vary, and some people with specific lipid disorders or genetic predispositions do respond to dairy fat with increased LDL cholesterol. If you have been told by your doctor that you need to specifically limit saturated fat based on your individual lipid profile and cardiovascular history, that advice takes precedence over general population recommendations. Discuss the specific question of dairy and cheese with your doctor in the context of your individual situation. For most older adults without specific lipid disorders, the current evidence supports including natural cheese as a regular dietary component. The muscle health benefits are real. The cardiovascular risk that was previously assumed has not been borne out in the research with the consistency that was once believed. Let me close by bringing this into practical daily terms, because the goal is not for you to have a more sophisticated understanding of cheese. The goal is for your muscles to receive better nutritional support starting this week. A practical daily cheese strategy for muscle maintenance might look like this. Morning: 2 tablespoons of grated Parmesan added to scrambled eggs or an omelet with vegetables. This adds protein and calcium to a meal that is already protein-rich, distributing amino acids across the morning meal for sustained muscle protein synthesis stimulation. Afternoon or midday: 1 to 2 slices of Swiss cheese alongside a salad, or as part of a lunch that includes another protein source. This contributes to midday protein intake and provides K2 and calcium. Evening meal: a small amount of feta crumbled over roasted vegetables, or a salad alongside your primary protein source. This adds flavor, protein, and anti-inflammatory fatty acids to the evening meal. Before bed, half a cup to a cup of cottage cheese or a small serving of ricotta with berries. This is the pre-sleep casein protein strategy, supported by the Maastricht research, providing slow-releasing amino acids through the overnight period to support muscle protein synthesis while you sleep. This is not a dramatic dietary overhaul. It is a strategic addition of foods that are already familiar, already available, and already enjoyed by most people, organized around a nutritional logic that the research supports. Your muscles are being broken down and rebuilt every day. The question is whether the rebuilding is keeping pace with the breakdown. The protein, calcium, and specific nutrients in these cheeses, distributed across the day in the way Dr. Clarence Martin has described, help tip that balance toward maintenance and preservation. That is the goal, not a dramatic transformation, not reversing decades of change in a matter of weeks, shifting the daily balance, consistently, in the direction of maintenance, so that next year you are stronger than you would have been, and the year after that, and the year after that. Consistency over time is how biology works. It is how muscle loss happened gradually. It is how the response to it works as well. Start this week. Add cottage cheese before bed tonight. Add Parmesan to tomorrow's eggs. Make the changes small enough that they are sustainable and specific enough that they are meaningful. I am Dr. Clarence Martin. If this was useful, please share it with someone over 60 in your life who has been told that cheese is something to avoid and has never been given the complete picture of what the research actually shows. Subscribe for more content that takes the nutritional science of healthy aging seriously and delivers it honestly. Take care of your muscles. They are the foundation of everything else.